Okay, this is lecture 21, the lymphatic system. It's actually a fairly short lecture. Most of the bulk of this material will be in lecture 22, the immune system. This one I left in the learning objectives and things. So for the lymph system functions, it transports and houses lymphocytes and other immune cells. You'll remember that lymphocytes are a type of leukocyte. They return excess fluid and body tissues to blood to maintain blood volume, and has lymphatic vessels, lymphatic tissues, not issues, and organs. And lymph is the fluid transported within lymph vessels. It comes from the interstitial fluid. Once it actually enters lymphatic vessels, that's when it becomes lymph. Here is just a depiction of that. You can see your lymph vessels on this side, and then your lymphatic tissues and organs on this side. Your primary lymphatic structures, you have primary and secondary. Your thymus and your red bone marrow being your primary ones, producing and maturing your lymphocytes. And then your secondary lymphatic structures, tonsils, lymph nodes, spleen, and MALT, as well as your inguinal lymph nodes. Those are going to be your secondary lymphatic structures that actually house and proliferate lymphocytes. Okay, so characteristics of lymph. Some fluid leaves blood capillaries. It is not reabsorbed by them. If you remember when we did chapter 20, we talked about filtration at capillary beds, how you have a lot of filtration on the arterial end because you have that higher hydrostatic pressure pushing fluid out. Only some of that fluid is reabsorbed back in at the venous end. There's about 15% or so that's left in the interstitial fluid. And if that were just left there, then eventually you would have edema, swelling in your tissues, as well as a drop in blood volume. So the lymphatic system takes in that excess fluid to maintain proper tissue fluid volume. So interstitial fluid moves into lymphatic capillaries where it is then called lymph. So it should make sense then that it's not really changed from the interstitium to the lymphatic vessels, so they look very, very similar. You have water, dissolved solutes, and a small amount of protein, sometimes some cell debris, pathogens, or cancer cells. Really similar components to what you would see in your interstitial fluid. Okay, so lymphatic capillaries, those are the small closed-in vessels that absorb interstitial fluid. We'll make this point a couple of times that lymph vessels are very similar to veins, and the way that they're structured. They're even lymphatic capillaries, similar to capillary beds. So these are closed-ended. So how does the fluid get in there? They're interspersed around most blood capillaries, absent in avascular tissues, red bone marrow, spleen, and cerebrospinal fluid. Slightly larger than your blood capillaries, they have no basement membrane. The walls are made of overlapping endothelial cells. These have flaps. These are the flaps between cells through which fluid enters but can't exit. So they're just kind of stacked one on top of each other. So fluid can kind of come in and push them open a little bit, but it can't then go back out. The anchoring filaments help hold them to nearby structures since they don't have that basement membrane. And specifically, lacteals are lymphatic capillaries found in your GI tract. They're absorbing their lipid substances from the GI tract, where your blood capillaries would be absorbing all of your other water-soluble ones. Here you can see in green the lymphatic capillaries interspersed around the typical capillary bed, as well as a kind of close-up with the valve system, or the overlapping cells. All right, movement of lymph into lymphatic capillaries. It is driven by hydrostatic pressure of the interstitial fluid. It pushes it into the capillary, the lymphatic capillary. Remember we said that as fluid is being filtered out of the arterial end, you're decreasing the hydrostatic pressure in the blood capillary, but you're increasing the hydrostatic pressure in the interstitial fluid. That interstitial fluid pressure will then push it back into the lymphatic capillaries. Anchoring filaments link the cells so that the vessels don't collapse. And the pressure of lymph inside the vessel forces intercellular openings, those flaps of the capillary bed walls, to close the lymph nodes. So as the hydrostatic pressure of the interstitial fluid forces fluid into lymphatic capillaries, then the hydrostatic pressure of the lymphatic capillary pushes the endothelial flaps closed so that fluid can't exit. It also makes sure that when the capillaries are full, they're full. Once those capillaries are pushing the flaps closed, the interstitial fluid can't push them open and force more fluid in there, potentially dehydrating your body tissues. Lymph will then move through vessels of larger and larger size. Capillaries lead to vessels, to trunks, to lymphatic ducts. Ultimately, fluid is returned to blood circulation at the subclavian veins. Okay, metastasis, that is wandering of cancerous cells, establishing secondary tumors. They develop in other locations in the body, so a metastasis. Breast cancer can metastasize to your lung. At that point, you would not have lung cancer. You wouldn't say that. You would say that you have breast cancer that has metastasized to the lung. It is still breast cancer, even though it has traveled to your lung tissue. Cancer cells break free from the primary tumor and then get transported through your lymph system. Okay, and let's look at those. The vessels, the trunks, and ducts. Vessels are fed by lymphatic capillaries adjacent to arteries and veins. They have all three tunics, just intima, media, and externa, similar to your arteries. They have valves like veins to prevent pooling and backflow of lymph. And it lacks a pump, so it moves lymph using the skeletal and respiratory pumps like veins do. The pulsal movement of blood in nearby arteries will help to force pressure changes in the lymph system. And rhythmic contraction of smooth muscle and larger lymph vessel walls in that tunica media of some of the larger vessels. Some vessels can connect to lymph nodes for lymph filtration. Your trunks are fed by your lymphatic vessels. You have your jugular trunk, subclavian, bronchomediastinal, intestinal, and lumbar trunks. The jugular drain from the head and neck, subclavian, the upper limbs, breast, and superficial thoracic wall. The bronchomediastinal trunks drain your deep thoracic structures, your intestinal trunks, most of your abdominal, and then your lumbar trunk drains your lower limbs and abdominopelvic wall. Ducts are fed by lymphatic trunks. These are your largest lymphatic vessels. There are two of them. You have your right lymphatic duct and your thoracic duct. These are going to lead back into your venous blood circulation. Your right lymphatic is near your right clavicle. It drains from the upper right quadrant of the body, so from the upper right side of the head, the neck, the upper limb, and the right side of the chest. You can't really see, so like the upper right side of the chest, the head of the neck, and then the arm as well. It's going to deliver lymph to the junction of the right subclavian and right internal jugular veins. So kind of right in this area, your right lymphatic duct will enter and kind of connect into your right subclavian, which joins into the inferior vena cava. Your thoracic duct is your largest lymphatic vessel. It runs from the diaphragm to the junction of the left subclavian and left jugular veins. It sits directly on top of your spine, so it's just the anterior portion of the spine. It has a sac-like cisterna-chyli at its base, which is about right there, just above the navel. It drains lymph from the left side of the head, the neck, upper left limb, the left side of the thorax, the abdomen, and both lower limbs. So essentially everything that your right lymphatic duct doesn't drain, your thoracic duct, your left thoracic duct does. So here you can see, again, the vena cava, the two subclavian veins, and then your thoracic duct right here, running just anterior to the spine. At its base, that's the cisterna-chyli, which is being fed by your lumbar trunks, your intestinal trunks. And then you can see these other vessels joining along, these little nodules. Okay. Lymphedema is accumulation of interstitial fluid due to interference with lymphatic drainage, causing swelling and pain in the affected area. May interfere with wound healing and contribute to infection because lymph does help to carry out cellular debris and pathogens and to filter our body fluids. When it gets backed up, then we can have malfunctionings and rather dysfunction in our immune system. Most caused by blockage on lymph vessels, trauma or infection, tumors, radiation therapy, scarring, surgical removal of lymph nodes. Controlled with compression garments, exercise, and massage. Extreme cases known as elephantitis, caused by infections with parasitic worms. There are some contraindications with massage. There are different types of lymphedema. There is pitting edema, where you poke into the tissue and instead of just immediately springing back, it kind of stays pitted. You can kind of see your fingerprints in it. That's a bad contraindication. That's usually unless it's something that's being managed currently, that is an emergency that you should really go see a doctor about immediately. But if it's just general edema where it's collecting and pulling in the limbs, then having manual manipulation to move that fluid back up into circulation can help, especially if someone is less mobile or immobile completely. There's some questions with these if you want to answer those. You do not have to submit any of these questions. Okay, lymphatic tissues and organs. You have primary and secondary structures. Primary involved in the formation and maturation of lymphocytes. That would be your red bone marrow and your thymus. Your secondary lymphatic structures, they don't form lymphocytes, but they house them and other immune cells. They're the site of the immune response initiation, meaning that pathogens will circulate through these secondary lymphatic structures and encounter your lymphocytes. So your secondary lymphatic structures house these immune cells, and then as fluid is brought through these secondary lymphatic structures, they're exposed to the immune cells and you can have an immune response. Your lymph nodes, spleen, tonsils, and lymphatic nodules, as well as MALT, your mucosa-associated lymphatic tissue. And just kind of think about those terms. Don't let the big name scare you. Mucosa-associated. Your mucosa is the lining of your gastrointestinal tract. Associated lymphatic tissue. Nothing too weird. Okay, red bone marrow, located between trabeculae of spongy bone. So remember the trabeculae are kind of those lattice-like structures within spongy bone that house red bone marrow, create space for red bone marrow. It's in the flat bones of skull, ribs, sternum, vertebrae, the ossa coxae, which are your hip bones, the heads of the humerus and femur. That's for adults. When we're children, the red bone marrow is more proliferative throughout our body. As we age, that red bone marrow gets converted to yellow bone marrow, which is also one of the reasons why, as we age, our immune response starts to slow down. Red bone marrow is a site of hemopoiesis, which is a production of the blood's formed elements that include T and B lymphocytes. They migrate the T lymphocytes to the thymus to complete maturation. That's why they're called T lymphocytes. Here is just that image, that depiction. You can see coming from the red bone marrow, all the formed elements that you get, and the maturation of those T lymphocytes in your thymus. So your thymus, it is involved in T lymphocyte maturation. It is a primary lymphatic organ. It's located in the mediastinum, that cavity that holds your heart. It is larger in children than adults. It grows until puberty, so it gets larger from the time of birth up until puberty. It is growing and proliferating, and then it starts to regress, gradually replaced by adipose tissue in adulthood. It consists of 2 thymic lobes, each surrounded by a connective tissue capsule. And then it has these trabeculae. It has these kind of interwoven passageways that's subdivided into lobules. Each of those has a cortex and a medulla. Both are lymphoepithelial tissue. The cortex contains immature lymphocytes. The medulla contains mature. Medulla, mature. At this point, that's all you really need to know about it, is that the thymus has a cortex that has a medulla. The cortex is immature. The medulla is mature. Once we get into the immune system, we'll talk about testing T lymphocytes and activation of those. Here you can see the thymus sitting just on top of the heart. This is in a child, and then in an adult, how much it regresses. And there's just a histology representation of that. You can see all of this white adipose tissue that replaces your active thymic tissue. Okay, onto the secondary lymphatic structures. A little bit more happens here. So the secondary lymphatic house lymphocytes and other immune cells within a reticular connective tissue matrix. Reticular connective tissue is just a type of connective tissue. It's organized into lymphatic organs and aggregates of lymphatic nodules. So we'll see that there is a slight difference between these two. Lymph nodes are not lymphatic nodules. Lymph nodes are actually lymphatic organs. Again, we just like to confuse you sometimes, so that's how we do it. So the organs have a complete capsule of dense connective tissue. That's your spleen and your lymph nodes. Your other lymphatic structures have incomplete capsules or don't have one. Tonsils, MALT, and diffuse lymphatic nodules. So organs have a connective tissue capsule. There's those two, and then the other ones do not have that connective tissue capsule. Starting with lymph nodes, they're going to be filtering your lymph and removing unwanted substances. Small, oval, encapsulated structures. They're encapsulated, so they're organs. Located along deep and superficial pathways of lymph vessels. And they occur in clusters receiving lymph from your body regions. You have cervical, axillary, and inguinal lymph nodes. These, especially the cervical, all 3 of these are fairly superficial. If you just take your hand, your fingertips very lightly, and rub them along the back of your upper neck, and again, you're just you're just going very superficially deep to the skin. It's not within the muscle tissue. It's in between that muscle tissue and the skin. You'll feel these little ridges and bumps, and those are your lymph nodes. And so when doctors are palpating kind of along your neck for your lymph nodes, they're trying to see if they're swollen. If they're swollen, that usually indicates some type of infection. They occur in clusters. That's going to be important, we'll see, for their function to be able to allow lymph to filter and pass through each one of them successively. Okay, you have an afferent lymphatic vessels bringing lymph to the node, afferent arriving to the lymph node. The efferent is exiting the lymph node, efferent exit. Located at a hilum. We'll see hilum occurring in several different things. A hilum is just a passageway. It's just kind of the opening within an encapsulated structure that the vessel exits out of. You have hilum in your lungs, you have hilum in your kidneys, you have a hilum in each one of your lymph nodes that allows the vessel, the efferent vessel rather, to be in connective or continuous with the capsule of the lymph node. Dense connective tissue encapsulates the node. You have, again, trabeculae just subdividing it. An outer cortex, inner medulla. Medulla is always in the middle, middle. You can see this outer cortex here, the medulla, and here, and these little lobules that it gets divided into. The cortex on the outside contains lymphatic nodules. These have that reticular connective tissue supporting a germinal center. Okay? So it houses proliferating B lymphocytes and some macrophages. So B lymphocytes, those eventually become plasma cells which produce antibodies, and macrophages are going to phagocytize any pathogens. The surrounding mantle zone has T lymphocytes, macrophages, and dendritic cells. Again, these are basically going to kind of clean things up and eat them. T lymphocytes, we'll see, will kind of initiate and help with the immune response. The sinuses, the cortical sinuses, are tiny open channels lined by macrophages, lined by more phagocytic cells. What I want you to be able to understand from this is, partly, yeah, the structure of it. Know that you have the inner germinal center, you have the cortical sinuses connecting them, and then you have this outer mantle zone. You should know all of that stuff. But really what I want you to be able to see is the different types of cells that are going to be in each one of those areas, and what the purpose for that is. Why do you want to have this kind of inner area of B lymphocytes and macrophages, this outer area with T lymphocytes and some phagocytic cells, and cortical sinuses lined with phagocytic cells? What does it allow for? Considering that things move from the outside in, even within this, fluid is going to move from the mantle zone into the germinal center through the cortical sinuses. So what does that allow for, kind of hypothesizing as far as evolutionary characteristics of the immune system? The medulla contains medullary cords. This is a different type of connective tissue that supports B and T lymphocytes as well as some macrophages. Again, different types of cells, different purposes for each of those. Ponder on that. What is the importance of having all of that? Medullary sinuses are tiny open channels lined with macrophages. Yeah, should be pretty straightforward. Yeah, again, I'm not going to be as picky with the specific structure of a lymph node. You should know the difference between the cortex and the medulla, the mantle zone and the germinal center, and what types of cells are found within each of those areas, as well as, again, I said, the structural and functional importance of having those varied cells lining and within all these passageways. All right, so flowing through the nodes, lymph flow through the nodes. Lymph enters through several afferent vessels. Excuse me. That creates a pressure gradient to push it through the node to the single exit vessel. So you have a lot of vessels coming in, bringing a lot of fluid in. Only one vessel leaves, and so this increases the hydrostatic pressure within the lymph node, forcing the fluid through the lymph node. Lymph is then monitored for the presence of foreign material, macrophages removing foreign debris, lymphocytes that may initiate your immune response, your B and T ones. They proliferate, especially in the germinal centers, and cause enlarged lymph nodes that can be palpated in the neck and in the axilla. The ones in the armpit are just kind of on the front, and they wrap around to the side a little bit. Lymph exits the node through the efferent vessel, and then it may pass to a neighboring lymph node. So again, they're kind of arranged in clusters typically, so lymph doesn't just get filtered through one lymph node. It's going to be filtered through multiple lymph nodes typically before it then returns into the trunks. Lymphoma, malignant neoplasm from lymphatic structures, it's a tumor. Non-tender enlarged lymph node, possible night sweats, fever, and weight loss. You can have Hodgkin's lymphoma, which affects young adults and people over 60. Caught early, it can be usually treated. Non-Hodgkin lymphoma is more common. Some kinds are very aggressive and others are slow growing. Because of lymphatic system's role in circulating fluid, non-Hodgkin's lymphoma can be very, very deadly. Spleen is the largest lymphatic organ, located in the upper left abdominal quadrant, posterolateral to the stomach, so behind and to the side of the stomach. It's convex and rounded. Anteromedial border is concave. Again, it has a hilum that has the entrance and exit for the blood vessels. Splenic artery supplying blood, the splenic vein draining it. It's all surrounded by a connective tissue capsule, and again, trabeculae, those connective tissue dividers. It divides the spleen into your red and white pulp. We'll see. You can probably guess what the red pulp is made out of. White pulp is a cluster of B and T lymphocytes and macrophages around a central artery. So again, you have these immune cells surrounding a central artery supplying blood. We'll see that with the spleen, it does not filter lymph, even though it's a lymphatic organ, it filters blood. The red pulp contains erythrocytes, platelets, macrophages, and B lymphocytes. So red blood cells, your platelets for clotting, macrophages for phagocytizing, and B lymphocytes for producing antibodies. You have splenic cords and splenic sinusoids. The cords are cells in reticular connective tissue. The splenic sinusoids are permeable capillaries. Remember, sinusoids have those big gaps and holes in them to allow for larger proteins and formed elements to pass. The spleen is also the storage site, or the red pulp rather, is a storage site for erythrocytes and platelets. About 30% or so of your blood and platelets are stored in your spleen. So that way when you're needed for excess circulation, if you have blood loss, then your spleen can release these stored elements. Okay, here is the red and white pulp of the spleen. You can see the white pulp right there in the middle, surrounded by this outer red pulp. Again, same thing here. Here's your white pulp surrounding that central artery, and then your red pulp. Monitoring blood flow. So the spleen filters and monitors blood, not lymph. That's an important distinction with this. The white pulp monitors it for foreign materials and bacteria. So your macrophages and the sinusoids of the red pulp will remove particles, phagocytized bacteria, debris, and defective erythrocytes and your platelets. It flows in through the splenic artery, passes into a central artery, it goes into the sinusoidal capillaries, returns through venules, and eventually the splenic vein. More important is the summary of the functions: eating foreign particles, clearing defective erythrocytes and platelets, and storing erythrocytes and platelets. 3 important functions of the spleen, you should know those: eating foreign particles, clearing defective erythrocytes and platelets, storing erythrocytes and platelets. In the first 5 months of the fetal life, the spleen is making your blood cells rather than your red bone marrow. This function can be reactivated under certain conditions. Hematologic disorders could activate that. You can have your spleen removed, a splenectomy, due to a ruptured spleen from an abdominal injury, infections, cysts or tumors, lymphomas or cancers, blood disorders, may be prone to more life-threatening infections if you don't have that, because you're all of a sudden losing this organ, which is clearing out and phagocytizing in your blood. Okay, moving on to other structures, your tonsils. You have 3, your pharyngeal, your palatine, and your lingual tonsils. The pharyngeal are in your nasopharynx, so in your upper nasal area, or in your posterior nasal cavity, rather. You have your palatine tonsils, which are the ones in the back of your mouth. You can see them. And you have your lingual tonsils, which are along the posterior one-third of your tongue. These are secondary lymphatic structures. They provide immune surveillance of inhaled and ingested substances. So when you breathe things in, when you drink them, eat them, their tonsils are there to monitor them for any kind of pathogenic substances. They have tonsillar crypts, which are invaginations that work to trap material, and contain lymphatic nodules with some germinal centers. Okay, so these are unencapsulated, they're secondary lymphatic structures. They're there just to monitor any airflow, any pathogens that are passing through us. Acute tonsillitis is an inflammation and infection of the tonsils. The palatine are most commonly affected. They can redden and enlarge, maybe partially obstruct the pharynx. Fever, chills, sore throat, difficulty swallowing, may be infected by viruses or bacteria. Persistent recurrent infections, chronic tonsillitis, may require a tonsillectomy. A lot of people have had it. It's not that bad. The ones in the nasopharynx, your pharyngeal ones, if those are chronically enlarged, they're called adenoids. All right, moving into lymphatic nodules and MALT. So lymphatic nodules are clusters of lymphatic cells with some extracellular matrix, but they're not completely surrounded by a connective tissue capsule. So they're kind of, you can kind of think of them like lymph nodes, but they're not completely encapsulated. They're also scattered all through diffuse, scattered nodules termed diffuse lymphatic tissue because they're just kind of scattered all throughout. They're not arranged so much in clusters like lymph nodes are. They are found in every body organ. They do help to defend against infection. And in some areas, they group together to form larger structures like MALT. So they're not so quite diffuse, but they're still not encapsulated, so they're still not lymph nodes. So again, hopefully you can see that just because they're scattered, just because they're secondary and they're not really lymphatic organs, it does not mean that they aren't crucial to the lymphatic response. They're found in every organ. Your MALT is that, again, that mucosa-associated lymphatic tissue located in your gastrointestinal, respiratory, genital, and urinary tracts. Anywhere really that you have a mucous membrane, or you can think of those membranes. Found in the lamina propria of the mucosa to defend against foreign substances. Prominently in the small intestine, it's called your Peyer's patches, your Peyer patches. Large collections of lymphatic nodules within the wall of the GI tract. Those are especially prominent in the ileum, which is the last part of the small intestine. I think that was the last slide.